So, common sense. Listen back home. When you guys go anywhere, any doctor, any dentist, if you don't want to get the work done, it's okay. But listen to what they have to say.
Sometimes if they have an idea, right, we have to make sure that we understand how they think that works, and then we have to explain to them how it actually works.
And if you don't believe in yourself, nobody else will. We believe in what we're doing here. We believe that we're doing right. And when we see something's not right, how many times have you guys gone home doing something right?
That is very true. I didn't think about that. That is very true. If we leave one high spot, we can cause damage to the tooth.
Cause damage a lot.
It's gonna hurt. It might need a root canal. It might break. Now imagine if you're having this thing where no one's checking it and you're just placing it on and you're just chewing.
I've seen how they say I got snap-in veneers. Snap-in veneers.
Wow.
Yo.
I am not a Google dentist.
I'm an Instagram dentist.
I am a real dentist.
Luis GPT. I'm just
Luis GPT.
No. But common sense, guys, just take the time to do your research. It's okay to question. We're perfectly fine with that. Any doctor you go to, you actually should question. But Google is not always right.
It was all a dream. I used to read Word Up magazine. Salt and pepper and heavy D up in the limousine.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. Listen, we're on Spotify and we're on Apple Podcasts. Don't miss your favorite episodes. Today we have Dr. Elias.
Hello, Frank.
And Dr. Luis.
Hello, Frank.
Welcome back, guys.
Welcome.
Yep.
It was a nice little podcast vacation.
I guess so. Yeah.
You know?
Or maybe 1 month. Yeah.
Yeah, it's been a while.
I forgot. I even forgot how to
Long time.
I had
talk
to
into
take
the microphone.
I had to take the spider webs off my mic.
Yep.
You know? Today I want to talk about something that our agents have been talking about, that we've experienced in 17 years here at the clinic, that you guys experience in your guys' career and compared to other dentists also. And we're going to name this episode, Common Sense is a Superpower. I was going to name it Common Sense is not a superpower, but it is a superpower because it's so rare. It's so rare. People don't have common sense.
Yeah.
And I want you guys to talk to me a little bit about things that you have experienced. And we're all going to go around like a round table of it could be dentists, it could be patients, it could be another agency, anything that doesn't have common sense that we see. So for example, I'll start. I've seen on social media, and I'm not going to name it because I don't know how it works. I might get sued. But I've seen how they say I got snap-in veneers. Snap-in veneers.
Wow.
So they're missing teeth here, and they have like their teeth are like everywhere. And they sent this pudding. You bite into it, you sent it in, and then they send you something that snaps in, and people are smiling, and they're like, "This has changed this has changed my life," because it's a big old plastic,
And it's loose.
and people believe these things. I go on the comments, and people are saying, "Oh my God, where can I get this?" Oh my, and all they're doing is they're lying, because you're gonna have a big old piece of plastic, and that looks like it doesn't even, the divisions itself. I mean, it looks fake. It looks like the Halloween vampire teeth, and they can't even talk right, and they're selling this fake dream to the patients, and people need to have more common sense. So I'll start it off with that. So who wants to pick it up from now, from common sense? Who has something?
I haven't seen that one, but I can kind of see what they're doing, right? Maybe it's just for pictures, but you're not going to be able to eat. You're not going to be able to speak. So it's just for pictures, honestly.
But it looks terrible.
I bet it does, because like, what are they?
Looks white, but it's a fake.
We'll put them up here. So
Yeah.
JT will put them up here so you guys can take a look at them back at home.
Yep. Looks on the picture. Looks a white smile.
No, it looks terrible.
Terrible,
It looks
yeah.
terrible. It really does look terrible.
Because too white is not like a natural. Okay, we have a different option for a white color. Here we have, for example, VL2 or VL1. But if you compare it to VL1 with that color, it's very different. it's like a freezer. The removable
Yeah,
veneers.
they're not fun.
Yeah.
I'll do another one real quick so you guys get warmed up.
I think I have one.
You got one?
I have one. But we were talking about this off air where people want veneers
Okay.
and their teeth are loose,
Okay.
right? Or they want crowns and their teeth are loose,
Oh, they're missing teeth?
or they're missing teeth and they want veneers to do a bridge, right? And then we have to talk a little bit about physics, how things work, right? And how we're going to apply pressure. Sometimes if they have an idea, right, we have to make sure that we understand how they think that works, and then we have to explain to them how it actually works.
And that's a challenge because
Yes.
not everybody can do that,
Yes, and not everybody's willing
to do it.
to do it, and not everybody's willing to understand because what they can say is, oh, because I can go outside and someone's gonna do it. For sure, I could do it too. I could do it, but it's not gonna work.
Yeah.
I mean, I technically can do it, but ethically, I know it's not going to work. It's going to break. You're not going to have a warranty over it, obviously, because it's not recommended. Or when people want bridges, and what I mean by a bridge is when we're missing teeth, but we only have a tooth back here and a tooth here in the front, and it's 7 teeth or 5 teeth or even 4 teeth that are going to be hanging on to just 2 teeth.
It's like the Brooklyn Bridge.
It's a very long bridge, and imagine we're replacing 4 teeth on just 2 teeth. So imagine the kind of stress that's going to be applied to these 2 teeth, because every time you bite, the extra pressure plus the pressure of their own crowns, it's going to weaken the teeth and they're going to fall out.
I've seen longer bridges. I've seen people that dentists here that done all on 4 kind of, but they left teeth inside. Have you guys seen those?
Which ones?
The one that people do all on 4s, but they weren't really on 4s. They put some implant and then they grasp onto also 2 tooth.
Oh, okay. So okay, yeah.
Yeah.
The thing about why we cannot grasp an implant to a natural tooth is because a natural tooth is gonna move.
Has a ligament.
Has a ligament.
Yes.
It's like a shock absorber on a car.
Yep.
So it's gonna do this. An implant is
Yep.
embedded into the bone. It's not gonna move. If we connect something,
Structure together.
a structure together, that's not gonna move. Imagine every time there's pressure, something's gonna give. Either the tooth's gonna give because it's gonna start moving.
Yeah.
It's gonna de-cement itself, or the implant, the connection is gonna break because there's gonna be something that isn't aligned with what it does. If it's two teeth, both of them are gonna move. So the bridge is gonna be stable. If it's gonna be 2 implants, and nothing's gonna move, so everything's gonna be stable. But if one thing moves and starts rocking, you're either gonna lose the tooth, it's gonna de-cement, or the connection from the implant, it's gonna break. That's why we cannot place bridges on crowns over our natural teeth onto implants. It's either implants on implants or
Yeah.
teeth to teeth.
Okay.
It's a different mechanical function.
Yeah.
For example, with the removable veneers, you cannot do any adjustments.
You
You
cannot do
can
anything.
cause like a problem on the ATM. It's very important to check that.
Yes.
The occlusion is it's a perfect contact. We have a perfect contact on the bite. It's very important. Any dentist need to check that.
That is
Yeah.
very true. I didn't think about that. That is very true. If we leave one high spot, we can cause damage to the tooth.
Cause damage a lot.
It's gonna hurt.
Yeah.
It might need a root canal. It might break. Now imagine if you're having this thing where no one's checking it and you're just placing it on and you're just chewing. You're gonna mess up your bite. Yeah, that's very true.
I like it. That is for emergency. For example, any emergency, that's good for 1-2 days.
Yeah,
before the appointment.
Maybe an emergency, like you're gonna go to a wedding.
Yeah.
And you just need the picture,
Yeah.
but not like a real solution.
Real solution.
Something
Because
temporary.
It's not like a temporary. It's for only 1 day.
Yeah.
What about the comments? We get a lot of our patients out there do their homework. You guys know that. A lot of our patients watch our podcast. We appreciate that. A lot of our dentists are Google dentists. What does that mean?
A lot of our dentists or a lot of our
A lot of our
patients?
patients, I'm sorry. A lot of our patients are Google dentists.
I am
Yeah,
not.
like,
I am
oh,
not.
no.
I am not a
Instagram.
Google dentist.
I'm an Instagram
I
dentist.
am a real dentist.
Luis GPT. I'm just
Oh.
no. A lot of our patients are Google
GPT.
dentists.
Google that.
Yes.
And they come in and
Yes.
and it's okay for them to believe something.
Yeah, for
I got
sure.
No problem with that. I go somewhere. I go to a dealership. I believe a car does this, and that.
And it's better than the other card because your opinion.
Because it's my opinion, right? But when they come to you guys and they say, no, you can do this. And you guys are like, no, well, look, I'll show you here in the x-ray. No, I've read about this and I've seen how you can do this. Common sense, guys. I don't go to a cardiologist and tell them, whoa, what are you going to do? But no, you got to cut on this side.
Yeah.
You're not getting it right. It's this side. Like, give me that right here. Just you don't do that.
No.
You don't do that. And our patients, some patients that
Yes.
we've encountered in 17 years or in the past 6 months, I've done this. Have done this, and you guys come up to me and you're just like, what's going on? So common sense. Listen back home. When you guys go anywhere, any doctor, any dentist, if you don't want to get the work done, it's okay. But listen to what they have to say. And hopefully you go to the clinic that explains to you, because it's just as important. It's part of our job to explain to our patients why that's needed. Show them why. You guys, I see you guys all the time with this. It looks like you guys are dancing back there.
Yeah.
And then when you guys
It's
go
fighting.
like this, I look through you guys through the camera or through the window, and I'm like, oh, they're explaining right there. and I can see when some of the patients are just like, and you're just like, you're like trying to get it through, but it's not coming through.
Yeah.
But so that's common sense.
It's hard
It's art. Why do you think that is? Like, why?
because we're trying to explain the type of cases and the type of work that we do is very specialized. So the dentists that we have here at the clinic are specifically trained for something that's very, very specific that not everybody else does, right? And once you start learning something, you realize that the more you know, the less you actually know. Because the more you know, then there's more possibilities, right? So we're trying to explain specialty things that even younger dentists have a hard time understanding to someone that's never been, to someone that's not a dentist. So it's like explaining rocket science to someone that's not a scientist or a rocket. So we try to get that's very difficult. We try to translate it to something very like
Information, yes.
to like apples.
We just had somebody last week, wasn't it?
Yes.
That go ahead and tell us the story.
She's probably never gonna watch this. So and it's good because she did a research. He or she did a research on grafting, right? And she has had a missing molar, a first molar, for more than 10 years. So the bone collapsed all around, right? But she's like, well, why don't you do a bone graft? And I was like, I can do a bone graft into the sinus, but you're still not gonna gain vertical bone because I don't have the bone around it to grow the bone. She's like, oh, all right. Next day she came in, she's like, oh, well, we talked about this yesterday, but I did my research and I have here a picture.
You're wrong.
Wow.
I was wrong, yeah. But she's really
Right.
She's like, she really wants to understand.
She was open.
Yeah, for sure.
Okay.
Like, and she's like, I don't understand it. And I try to, translate it easier to her. And she's like, well, I showed you a picture here. She's like, they're adding bone vertically. She's like, but you said you can't do that. And I was like, yeah, that's a socket. You still have the natural bone over here, natural bone over here, natural bone over here, but you're just missing this part. I can add bone here and it's going to look like this, but I already have the two spikes. And I was like, on your CT scan, you have like no bone everywhere. Like I cannot just grow bone vertically. And she's like, but I don't understand. So I had to get pictures. And she was like in a good attitude. Like she was trying to know why. Like she fully does trust me. But it was hard for her to understand. And it was hard for me to explain things that are even hard for a learning dentist to understand. But yeah.
I wasn't speaking about that one.
Which one?
I was speaking of one that you went back to and you're like, Frank, can you please help me? Do you remember that one now?
Yeah.
Okay.
Yeah, but
Tell that story.
that was common sense, right?
Oh,
that
there
was
you go.
Like very common sense. I had a patient. I was gonna do extractions, and I was gonna place implants and graft at the same time, close it, and one surgery, get it done, and that's it. But he wanted to extract the teeth, right? Come in the next week, place the implants and graft, but I couldn't understand why he wanted to do that. And I was telling him, hey, you know what? It's better because I do this one time. You know, I do the shots just one time, and you're done. You don't have to come back. He's from Phoenix. You don't have to come back like 2 trips. I could do it just in one go. He's like, yeah, but it's better if we do it twice because I don't know if I could do everything today. And I was like, the holes are already gonna be there. I'm just gonna.
It wasn't money wise.
Yeah, it wasn't money wise. I was like, if I do the extractions, the hole's already there. I'm just gonna place the implant. It's not gonna take me like 5 minutes more at the most. But he's like, no, I'd rather come back next week. And I was like,
Yeah.
I had
Because you can do it, but
I can.
But it's not the best way.
Yeah, it's not the best way for him or
For him, for you, yeah. Why 2 different surgeries in
So
7 days?
I was at the point, and I make fun of Luis sometimes because Frank helps him.
I don't know what he's talking about.
Frank helps him,
Yeah.
and I was like, damn, I really need Frank.
I need
Like
Frank.
it's not a language
Yeah.
thing, you know. It was like I don't know.
Yeah.
So I go up to Frank. I was like, and he's like, but why? And I was like, I don't know. He was like, so what did you tell him? Or what do you think? Like you as a not a dentist, but as a patient, like
you have experience with that.
what was going on there?
I think we just had to put it into perspective as we talked about a pot.
Yeah.
We said, when you have a plant, you take the plant out and there's a big gap. But you just put the other plant in and we're ready to go. And it just works better. And he said, let's do it. That was it.
That was it. A plant.
That was it. And Elias was like, what just happened? I said, there you go. But it was common sense, but sometimes we got to.
I couldn't bring it to like something that
He was like,
I was like tooth implant.
Tooth implant,
But I couldn't translate it to like common things.
common, yeah. That's yeah. It's tough sometimes.
Yeah, it is.
It's
It
tough
is.
sometimes.
Especially with engineers.
What about common sense? Let's talk about when we have a patient, and this is for the agents, our agents, and the patient calls in and says, I need to get all this work done. Well, we need x-rays or other good. I just want to get what this is. Okay. And let's say it's an all-in-4. This is the amount for an all-in-4. Well, why are you guys charging more? Because they always compare us with the ones that charge less.
Of course.
We the ones that probably compare us to the one that charges more, because we don't focus on price. We focus on quality.
On quality.
And on quality, guys, for our quality, we're really cheap.
Yes.
You know what I'm saying? Because we don't focus on making all the money from one patient. We focus on giving care to the patient, but then we have numerous patients that come in, and guess what? Then they compare us to somebody that's a lot cheaper. They're like, why are they cheaper? And then you kind of talk about different things, and then they call there and they say, well, if you can do it for this price, I'll do it with you. Common sense, you keep on coming back to us because we have more quality, but you don't want to spend to get that quality.
What it's worth.
Yeah.
For what it's worth, exactly. So if someone says something, and I'm not gonna throw any rocks or anything, but there's clinics out here. You guys do immediate loads, and you guys do immediate loads. We do immediate loads, right?
Yeah.
Okay. You guys, we have the CareStream 9600. Take a CAT scan. You guys take a look at it. I'm amazed with what you guys do, our team. Especially you guys. You guys are the ones that do the extractions if needed. You guys do the implant, and then you guys finish the prosthesis when they come back 4 or 6 months later.
Yeah.
Most of the places and doctors that I started following because of you guys don't do that. They do the implants. Somebody else does the prosthesis. Or they don't do individual implants. They do big cases only. But you guys, as compared to other really good dentists, for example, Sinada,
Yep.
he does a
Everything.
huge variety, right? So it's like a hybrid, right? And it's hard to be good at many different things. So when you guys do all that, you guys have a game plan on how you guys are going to put the implants, if you guys can do the immediate loads or not. How is that going to help out the patient? How is that going to help us us, you, for everything to be perfect on the second, because we don't want to redo things, and we don't want the patient to go through that either. So if we can't do something, we let them know. We let them know why.
Yep.
But if we could do it, we let them know we could do it. And I've heard about different places that they tell you they can do something. For example, immediate loads, and at the end they tell you, when you wake up, I wasn't able to do it because of this and that. But the planification, it was never there. They were never going to do it anyways. And they never charged the patient for it. They said, we'll throw it in for free. So now, if the patient, common sense, if at Supreme is this much to do them, and over here is free, why is it free? Then they wake up and they didn't get it done. Well, I couldn't have getting them done probably at Supreme. They can't get their money back because they didn't get charged for it. So, and that's how these clinics are competing against clinics that can do those things. How many times did we hear immediate loads are wrong, immediate loads are bad? And you're like, well, we didn't make this up. They're doing it around the world. Maybe not here at the time, but there's a world out there. And they're doing it. It's not like we're making things up.
And there's articles about that, you know.
But still, other dentists are like, oh, I don't know, man, don't do it, or it doesn't work.
Or other people that are not dentists.
Yeah.
Especially other people that are not dentists, they can't be done.
Yeah.
They can't be done. I remember when we were with a certain agency and we were talking about immediate loads, they're like, nope, no. Actually, we were here and we were talking about immediate loads. You were here, and this person that wasn't a dentist was trying to tell you why you couldn't do it.
Right.
And I remember you went back at him and told him, well, I'll let you borrow the book where it says that it was hardcore, bro. I was scared. I was like, shh, be quiet, bro. Just be quiet. Because this guy's he barely knows how to brush his teeth probably. And he didn't do a
Never
great
on
part
the
of it
life,
because
yeah.
he's seen it.
Yeah.
And you're arguing, and it's okay to, well, how can this be done? But arguing why it cannot be done because somebody who doesn't do it told them. First of all, congratulations to the other dentist that sold him so far on it until you got to slap him with the book. And then you brought the book.
Of course.
And you showed him where it says that. And
Yeah, because I'm going to base my opinions off of facts.
right. We base off of facts, not opinions.
Right.
Common sense, guys. Do you have anything about common sense?
Personality, always I am thinking to long term on my diagnosis.
Yes.
I am not thinking in money, honestly, because I don't want to see my patient here 6 months later or 4 months later with problems. I need to prevent any problem, any bad scenario in the future. For example, when I am doing any all-on-4, sometimes I prefer to do all-on-6. Why? Because we have two more pillars.
Mm-hmm.
More stability is better for me. I can't to prevent any problem.
That's actually common sense too.
It's not for money. It's to prevent another problems. Okay, I have experience with 4. I have very good experience with 6. That's why we need to explain the best option for my patients. It's very easy, but sometimes the patient they don't understand that.
Yeah, I think it's marketing more than anything that it's called all on 4.
It's a popular name.
Yeah,
All-on-4.
it's very popular, and I think that's where a lot of people go, oh, just 4.
Yeah, Noble did a great job.
Yeah, Noble, what's his name? Malo? Dr. Malo, Pablo Malo. But now we're trying to make it called full arch, because we want a full arch.
No, it's full
or all on X representing
It can be numerous.
numerous,
Number
5, 6,
6,
the
7.
implants that you need, that someone needs. And that's why I try to, sometimes we get 6'4", right, 280-pound male. He's like, oh, I want 4 implants. Like,
Oh yeah.
it's like, bro, like how? Like that doesn't make sense. So I try to it's like you're a big truck, right?
You put little rims.
And you're gonna put do you understand that it doesn't make sense? You're gonna need something that's a lot more
I understood that one.
Yeah.
So I try to like get it like to men to like for them to understand like, oh yeah, if it's a bigger car, it's gonna need bigger things. It's gonna need more support. But if it's like, I don't know, like a 5'2", 140-pound female, maybe 4 can do the trick. But it's all about like trying to get them into perspective of how we see things and pressure. Because even if the implants, after we place them in and once the implants have healed, that doesn't we don't count it as a victory yet. Because that's when the game really starts. Like that's when you're really
Yeah,
gonna start to chew.
After the surgery.
Yeah, that's when the pressure and everything, once it's healed in 4 months or whatever, and you come back and we put the final prosthesis in, that's when you're really gonna start eating, really good, start chewing. And that's we don't want that implant to fail in the future,
What about common sense when they're here at the clinic and it's the first day and they don't want to put no money down to start their process and they want to pay everything till the end? Where does that happen? Because I just went to the doctor in the United States and like they took my insurance down real quick, or they take some sort of payment real quick. Where's the common sense of I'm going to go back home and I promise you I'll pay you in 2 weeks?
That's
Like, what, is it because we're
not even dental.
Is it because we're in Mexico? Do you think
I don't know.
that people
I
think
don't know,
that
probably.
you're in Mexico, so I can do those type of things? Do you think that's what it is? What
For
about-
example, I'm
go for
going to Apple Store for one iPhone. I pay later, maybe next week. Can I do it?
Maybe if you go through financing, you can do it with us too, because we have financing. But oh no, I promise you, I'm a man of my word. Apple, I'm coming. You tell Mr. Apple that I'm gonna pay him. Just give me 6 months. In 6 months, I'll see you back. That's what Apple will say.
Yep.
Yep.
It doesn't. It's like a superpower. It doesn't make sense to me.
Like just as a business, not even dental anymore. It's
Ooh,
just
yeah, exactly. What about? Let's talk about another one. Ooh, you're gonna love this one. What about the patient on top is getting whatever? Let's say all crowns, or is getting a zirconia bar, okay?
Or veneers.
But they don't want to touch the bottom, and their bottom is like this.
oh, but they want the uppers ones to look straight.
But the uppers gotta go straight, and they gotta hit. So what magic trick do we do? How do we do it? How do we tell the patient? Well, the number one thing is for everything to be
It's
hitting.
difficult because sometimes the patient he is thinking from that you want my money. That's what you are recommending.
You want to do the bottom because you
the
want
bottom.
my money.
Yeah.
I want to do the bottom because it looks like a roller
But
coaster.
it's not for the money. It's for the position.
It's the foundation. I want everything to hit.
¿Cómo se dice? Mesh. Se dice.
Yeah. You want everything to mesh
The
together.
mesh-
Yeah.
mesh together. Yeah.
It doesn't. And you just had somebody like that not too long ago. And you're like, what do I do? What do I do? And the patient's like, no, well, you got to get it right. Like, what do we do?
Yeah, it's hard. It's difficult. It's difficult.
It's difficult. Yeah.
It's difficult. I try to show 'em models, like
Yeah.
of their natural teeth. That's why we have the scanners, the intraoral
Yeah.
scanners, and I try to show them like, bro, like everything's like this, and everything falls into place, right? But if I try to make the upper one straight, now you're not gonna hit.
It's like Legos.
Yeah. So how do I I have to make everything straight, uppers and lowers, so everything can hit good, But
What about the picture? They bring you a picture and they're like, I want to look like this.
oh,
And it's a picture from 1980. You can barely see
they're like, I want my natural smile, and they bring a picture from
a blurry
Oh,
picture. There's they're like standing
20 years ago. Yeah.
and you're just like, it's not even of them smiling. It's like smiling, but it's taken from far away, and it's like not a clear picture. And you're just like,
they want that smile, and I was like,
I have a lot of similar cases. Yeah.
and you're like, how am I gonna get? I don't even know what it looks like. You can just see the color.
yeah. Or we have people that want to design their own teeth, and
But they've never done this before.
no, but I even bring them to the back where we're designing. I was like, okay,
This is what we can do, and this is what we can't
go
do.
for it, and I tell them go for it. But or sometimes people as well that when they smile, because we're not symmetrical, but sometimes they smile and their lip goes higher,
Yeah.
Yeah.
and I tell them, well, that's your lip. Like, how do I?
And so you guys answered the dental questions, right?
Right.
Unless I know, because I kind of been here for like a long time, certain things like why you need to get an extraction of a bone graft or common sense things. I don't look at something and say this is 100% what it's going to be because I'm not a dentist. I don't want to put myself in that situation because I'm not going to do it. If I could do it, which has nothing to do with dental, then I'll do it. And why are you smiling, bro? And I think you think I know. He thinks I'm going a route, but I'm going to go a different route.
Yeah.
I want to take a whole U-turn. And so then we have our agents,
GPT.
and we have a patient. And so we have the patients that then, we have our agents. And our agents answer all the questions, and they go above and beyond. These guys are working on Sundays.
Yes.
They're from home. They don't have like an office hour. They're like, like all the time, like 100%. Big shout out to my team. But guys, every patient wants to speak to me. Why, guys? I've gone to Jack in the Box, and I want to talk to Jack, and never have I been able to talk to Jack. It's because I have people in place that can answer those things while I'm doing other things, and everything flows.
Yeah.
It's just insane how I need to talk to Frank. Does Frank know this is happening? I get all the emails too. Like my emails are linked to everything. I see.
Frank, tell me, please.
Frank, what's going on with my smile? Dr. Elias.
What happened? You explain me, please.
He can't get the top right when my bottom's like this. Like, what do they want me to say? Common sense. It's really hard for you. I will see you out there in the waiting room. I'll talk to you guys. See me talking to patients. You guys see me snapping pictures with patients. Remember that one? That was pretty cool. And I'm all about it, guys. I'm an open book. But like when something doesn't go a patient's way, common sense, they want to speak to me. But when they don't hear what they want to hear. But the ones that made these rules were my wife and I. And everybody knows the rules. They're completely transparent. It's not like, oh, I already sold you, the rules changes. No, everything is how it is, warranty, how it works. When somebody's like a full mouth, right? And you're just like, hey, I'm gonna let you walk around with temporaries, with your permanent but temporary glued on, so you can tell me, which we shouldn't even be doing that, but so you can tell me how much you like your smile, any changes you want. Then the patient comes back the next day and says, I love my smile, Dr. Luis. You're the best. Takes a picture with you. 4 days later,
Yeah.
he hates the smile. What just happened?
Yes.
You said yes. You had them on your mouth. Common sense. We can change anything you want on them.
That's impossible.
And now you have them cemented and now you hate it. How? How does that work? How does that work? Or patients that they change their appointment. You know what? I'm not feeling good today. I'll do it tomorrow. And then tomorrow we have a space for them. Oh, you know what? I'll do it another day. Then all of a sudden they got 2 days left and they're like, you guys need to make this happen because we're going to fly out. What? What happened? Like, what am I missing? I feel like you, when you were trying to talk to that patient, like, what am I missing? I don't understand.
The thing about
Common sense.
the thing about doing the correct diagnosis is that you need a lot of things to make a conclusion, right? The 3D scan, 3D image, a CBCT, is only an instrument to make a decision. It's not the sole like thing that you can rely on 100%.
Yeah, 'cause you go in there and things might change, right?
No, and you need to talk to the patient, see it clinically, and see what's going on, right? Because it's just an image. It's just an image, and you can represent it however you want,
Okay.
right?
Because
And sometimes if you see a dark spot, it can be an infection, right? But if you talk to the patient and you know that they've had a previous root canal, it can just be a scar
Yeah.
as well. It's not. It
It's an
doesn't.
old infection for years ago. Yeah.
And it's just a scar. If it's an infection, you're going to see a hole on the CT scan, but also inside the patient's mouth, you're going to see a fistula. So you know it's an active infection.
Or
But sometimes you see the dark hole on the CBCT, but you don't see on the mouth anything. It doesn't hurt. It just means it's a scar. But you can represent, interpretate a CBCT, but you got to have the other part as well to make a final decision. It's just an instrument to help you make something.
It's because you're doing science. It's not like a technician work. You can combine different things. the X-rays, your experience, the clinical.
That's why you guys believe a
clinical-
robot cannot
Yeah.
be a dentist,
Yeah.
Yeah.
because there's no one size fits all.
Nope. And every patient is different. There's different things. They feel different things. So yeah.
But no. It's good to talk about all these great things, guys. There's just common sense. There's just so many common sense. Shuttle. We have patients that say, "I'm going to cross the board. I'm going to cross the border," because we do not. We shuttle patients here, but we shuttle patients back to Yuma or to the airport. But they got to cross the border by themselves. Because common sense, we don't know if for any reason they purchased a medication that they're not supposed to. And you know what? I trust all of our patients, but I don't trust them enough to change someone's life to be able to cross with you in the same car. And now you thought something was legal or wanted to be sneaky, and now that patient, my shuttle loses his papers forever, and you change someone's life. So better yet, we'll wait for you on the other side. And we'll pick you. And then when you cross walking, we'll pick you up. And then we're on to your destination. But we get a lot of times when they're trying to go back to the Yuma shuttle. And some of our patients say, "Oh, yeah, I'm going to be across in 10 minutes. But there's a long line. So the shuttle cannot just stay parked across the border because, as you guys know, that's the Quichan. So he keeps on circling. And then he waits 5 minutes and he circles back. Then 10 minutes and he circles back. And some patients have gotten really upset because they waited 5 minutes for the shuttle, for the free shuttle. Free shuttle. If you call a cab, you wait. Then you go into a cab and you don't know who the driver is.
You still get charged.
You get charged. You don't know what smelly things are in there or there was. Our shuttles, I got to say, they're extremely clean. Every time they take patients, they sanitize. They do a great job of doing things, and some patients, sometimes, we have the great experience. Dr. Louise gave me back my smile. I'm so happy, but the shuttle, let me tell you, was 5 minutes late. So here's a 1 star. What? Like, what just happened? So everything has just, here's a half a star. I wish I could give you
Terrible
worse.
experience.
Don't go to this
Yeah.
clinic. Their shuttle is
For
5
the
minutes
shuttle.
late.
Yeah.
It's okay. Well, you just keep on smiling, So, I want to thank you guys for being here today.
Thank you.
And I went to Coachella this past weekend, and I don't think any kids watch this podcast.
That'd be weird.
And it'd be pretty cool. If kids are like, "Oh, I want to be a dentist. I want to be a Dr. Luis. I want to be a Dr. Elias, but better looking." Like Alonzo.
Like Alonzo.
I would think more kids want to be like them, but it's okay. What's it called? And there's a rapper named Post Malone. And he said something. He said, and pardon my French, he said, I forgot what he said. I'm just kidding. He said, "Believe in yourself. Because if not, no other mother will." And that just blew my mind because, I've heard it, but when he said it, he's really humble. And if you don't believe in yourself, nobody else will. We believe in what we're doing here. We believe that we're doing right. And when we see something's not right, how many times have you guys gone home doing something right, and then something, medically, sometimes it still fails, or a small portion of it, and you guys think about it so much. And you guys go back to the books. You guys do this. You guys do that training. We get really complicated cases that other clinics can't do. And Lori Tuck, Texas didn't even want to help her out. And she's here, and we give them back their smile. And it's because you guys believe in yourself. You guys believe in the brand Supreme. And because of that, we have sponsors like Snow, which is the #1 whitening in the United States, according to Forbes. They believe in us. Our 10 international accreditations believe in us. I believe in you guys. You guys believe in us.
Thank you.
So I'll end there with a good note. So if you guys are out there, we're going to do a class on common sense. I'm just kidding. But common sense, guys, just take the time to do your research. It's okay to question. We're perfectly fine with that. Any doctor you go to, you actually should question. But Google is not always right, because Google did not look into your mouth. Google is not touching your gums, is not opening and seeing your bone, and is not taking a look at your specific x-rays. So with that, this has been Supreme Dental Podcast Studio, powered by Supreme Dental Podcast, powered by Supreme Dental. And just like these two guys, keep on smiling.
That's right.
And if you don't know, now you know.